Right guys, welcome to Psychopathology Lesson 5. This video is going to look at cognitive treatments for depression, and it's going to be really important that you have a good working knowledge of the cognitive explanations for depression because they underpin this therapy. So, in this video we are going to be focusing on cognitive behavior therapy. We're going to look at what it is in general, and then we're going to have a look at two specific types of CBT. We're then going to look at some evaluation points, and we're going to finish up with an example 6-mark outline so that you can see how all of it would come together in an essay. So, let's get right to it. CBT is the most commonly used psychological treatment for depression and a whole range of other mental health problems. The aim of the therapy is to identify and change irrational and negative thoughts. Now, all CBT works in the same way, and all CBT includes both cognitive and behavioral elements. It always starts with an assessment in which the client and the therapists work together to clarify the problems. They jointly identify goals for the therapy and they put together a plan to achieve those goals. The main task is to identify where there might be negative or irrational thoughts that would benefit from being changed. Now, in addition to those bits, which are technically the cognitive elements of the therapy, there are also behavioral elements. And the behavioral elements are all about changing and challenging the irrational thoughts and putting more effective behaviors in place. And that can happen through a variety of different techniques that will depend hugely on the type of CBT that you've decided to have. So there are two types of cognitive behavior therapy that we're going to look at today. Like I said, all CBT follows the same kind of logic and the same principles, but the techniques that might get used would differ depending on the type of CBT. The first that we're going to have a look at is Beck's cognitive therapy, which comes about from Beck's cognitive theory, which we looked at in the last video. And the second one is rational emotive behavior therapy, and that came about through Ellis's ABC model. Beck's cognitive therapy is the application of Beck's cognitive theory of depression. And the idea behind the therapy is to identify automatic negative thoughts about the world, the self, and the future, also known as the negative triad. Once those thoughts have been identified, they can be challenged, and that's the central idea of the therapy. As well as challenging the thoughts directly by questioning the client's beliefs, the therapist might also set the client's homework, such as keeping a diary of when they enjoyed themselves at an event, or keeping a log of when somebody was nice to them. Effectively, the client is encouraged to test the reality of their negative beliefs. And then the findings from those little experiments can then be used in future therapy sessions. For example, if a client were to turn around and say that nobody likes them, the therapist could then refer them back to that piece of evidence to prove them wrong. Another form of CBT is Ellis's rational emotive behavior therapy. Now, if you remember, Ellis developed the ABC model, where an activating event leads to an irrational belief, which then ultimately triggers depression. REBT extends the ABC model to include a D and an E element, where the D stands for dispute and E stands for effect, which ultimately means that the therapist is going to argue with you in order to try and replace your irrational beliefs with more effective ones, which will then lead to more effective behaviors. For example, a client might talk about how unfair things seem, and a therapist would then identify that as examples of utopianism and challenge it as an irrational belief. That would involve vigorous arguments whereby the intended effect is to change the irrational belief and then break the link between the negative life event and depression. Now, disputing is the hallmark of REBT, and disputing is this vigorous argument that very often happens between therapist and client. And Ellis identified different ways in which disputing can happen. For example, you've got empirical disputing, which involves challenging whether there is actual evidence to support the negative belief. You've got logical disputing, which involves challenging whether the negative thought logically follows the facts. And then you've also got something called pragmatic disputing, which questions whether the belief is actually a helpful one in terms of solving the problem at hand. Any one of these can be used by a rational emotive behavior therapist, and each one of those would be used to try and break the link between the negative life event and depression. Another technique that cognitive behavior therapists often use is called behavioral activation, which effectively means you're getting people to do stuff. Now, the purpose behind this is that as individuals become depressed, they tend to be increasingly isolated and they tend to increasingly avoid difficult situations. And that then effectively maintains and worsens the symptoms. The goal of behavioral activation is to work with depressed individuals to gradually decrease their avoidance and isolation and increase their engagement in activities that improve mood. And those activities could be anything. It could be exercise, it could be going out for dinner, it could be meeting up with your friends, it could be anything. It could be, like in the picture, pushing a really big boulder over the side of a hill. It doesn't really matter. It is just about getting out, it's about exerting yourself potentially, or just meeting friends for a walk. But just something that means that people aren't isolating and aren't sitting at home doing nothing. Any activity that the patient does undertake is then reinforced by the therapist, and then with a little bit of luck, they're going to want to do it again and again and again. So, I hope all of that has made sense. I just have a little bit of outline advice for you. In an exam, you are unlikely to actually ever specifically be asked about REBT or Beck's therapy. You're just going to be asked about CBT. Or more specifically, you're going to get asked about cognitive treatments for depression. REBT and Beck's cognitive therapy are both types of CBT. But all CBT works in the same way. It's just the techniques that might differ from style to style. For example, REBT uses vigorous disputing. It's going to be really important for you to be able to outline the general idea behind CBT. And that was kind of the first slide that we talked about with the aims of CBT and the goal setting and the challenging irrational thoughts and all of this stuff. So start off with any outline just talking about CBT in general, because you can then branch out and talk about individual types of CBT and what they do. Okay, and I'll show you an example towards the end of the video where you can actually see what a 6-mark outline would look like, where I've done exactly that. Okay, so let's have a look at a couple of evaluation points before we look at our 6-mark outline. I've got 4 evaluation points for you, and we're going to start with one really important one, and that is research support for the effectiveness of CBT. If there is one evaluation point that you learn for this topic, then please make it this one. It's research support, it has a study to back it up, it's going to be a really powerful evaluation point to know. Okay, so you've got research by March et al. From 2007 who found that CBT was as effective as antidepressants in treating depression. The way that they found that out was that they took 327 adolescents with a diagnosis of depression, and then they compared the effectiveness of CBT, antidepressants, and then a combination of CBT and antidepressants. And they found that after 36 weeks, 81% of the antidepressant group and 81% of the CBT group had significantly improved. They also found that 86% of the combination group had significantly improved, which shows that not only is CBT really effective at treating depression, so much so that it rivals antidepressants, but actually it also shows that CBT works very well alongside medication as a combination therapy, and that then would make it even more effective than just one therapy or the other. Okay, so that's a really nice strength to learn. Moving on, we have a limitation, and that is that CBT could be ineffective for very severe cases of depression or people with learning difficulties. Now, the reason that it might be ineffective for severe cases of depression is that CBT requires motivation. And unfortunately, motivation may not be present in people with very, very severe cases of depression, which means that they won't be able to engage with the work or pay attention to what's actually happening in the sessions. For those people, it's actually very likely that they're going to need antidepressant medication first in order to then fully be able to access CBT. And obviously the problem with that is that CBT doesn't then work as a therapy by itself, which is obviously a bad thing. Furthermore, it's also possible that the cognitive work that is associated with CBT could make it unsuitable for people with certain learning disabilities. And Sturmey from 2005 even goes so far as to suggest that psychotherapy of any kind is unsuitable for people with learning difficulties. And that then suggests that CBT may actually only be appropriate for a specific range of clients, which obviously reduces its effectivity overall. However, that being said, there is a counterpoint to this suitability, and that is recent research evidence challenges the idea that CBT is unsuitable for severe depression and people with learning difficulties. And then you've got two pieces of research there. Lewis and Lewis from 2016, a very recent study, concluded that CBT was as effective as antidepressants and behavioral therapy for severe depression. And then you've got research by Taylor et al., who concluded that when used properly, CBT is effective for people with learning disabilities. So actually, it's not that the therapy in general is unsuitable, it's just that it might need a little bit of tweaking, and then at that point, it will be effective for people with learning disabilities as well. So that means that CBT may in fact be suitable for a wider range of people than was initially thought. And then as a final limitation, you have the relapse rates. Now, although CBT seems to be quite effective in tackling the symptoms of depression, there are some concerns about how long-lasting those benefits are. Recent research suggests that actually the long-term outcomes are not great. For example, in 2017, Ali et al. Assessed depression in 439 clients every month for 12 months following a course of CBT, and 42% relapsed within 6 months of ending the treatment, and 53% relapsed within a year. And that means that CBT may actually need to be periodically repeated if it's going to maintain its effectivity. Okay, and just to finish off, I'm just going to show you a quick 6-mark outline for this topic. So I'm going to start with a generic paragraph that talks about what CBT is. I'm then going to move on and I'm going to talk about the fact that there are different forms of CBT, but actually the ultimate aim to identify and challenge negative and irrational thoughts always remains the same, despite the fact that approaches to those aims might differ. I'm then going to really hone in on one particular type of therapy, REBT in this case, and I'm going to explain what the approach in REBT is. I'm then going to finish off with a little bit more of a generic paragraph again and talk about the fact that cognitive behavior therapists may set their patients' homework. There is a little bit of a specific line in there about Beck's cognitive therapy and about how patients would be encouraged to test their own beliefs and prove them wrong. And then there's also a little bit in there about behavioral activation and about how that would be reinforced by the therapist. Okay, so this is just a nice example of what I was saying before. It's not about outlining REBT or about outlining Beck's cognitive therapy. It is about explaining what CBT is in general and then using those individual therapies to highlight your points. Okay, so I hope all of that has made sense. If you've got any questions, please pop them in the comment section below and I will do my best to get back to you ASAP. I hope it's been useful, and thank you very much for listening.